In the meantime, we're talking with Congressman Brian Higgins. 22 minutes left, a lot of phone calls. We'll talk in a little bit about how many calls your office has been getting, because I would guess that this issue is really heating things up. But let's go right to the phones now. Gary in Williamsville, you're on the air.
Brian Higgins, I am an independent. I am not part of any group. My concern with you and your 534 other members of our representation government is that you are spending us into oblivion. The Chinese have told us, the rest of the world have told us, we're concerned about the amount of money that the United States is spending. We're $11.5 trillion in debt, and we're looking at multi-trillion-dollar deficits for the next 10 years. It won't matter what kind of health care you come up with if the country is bankrupt. Do you understand that concept? Do any of the people in Congress understand that concept? You are all guilty of betrayal and criminal treachery against the taxpayers of this country. Stop spending our money that you don't have.
Jump on in, Brian. Go ahead.
Well, healthcare costs consume 17% of the economy of this nation. It'll only increase if something's not done to curb the growth in healthcare spending. And obviously, 17 product is a significant part of our economy. We are adopting pay-go rules in Congress. That is, any
pay-as-you-go.
Pay-as-you-go. Any program that you advance, it has to be paid for, and it has to be confirmed by the independent, nonpartisan Congressional Budget Office that provides fiscal analysis for individual government initiatives.
Are there issues for which deficit spending is required?
In times, not required, but in times of recession. We are still in the midst of a severe economic contraction from which we are trying to get the economy to grow again. It's showing signs of improvement, but we have a long way to go. And it wasn't that long ago when we had, a federal government that was had a surplus, a federal government that was virtually debt-free. We had a nation that made things and sold them to the rest of the world. Now the nation that used to make things and sell them to the rest of the world buys the things that are made elsewhere.
So are you saying then that the days of smaller government spending were a part of history that we just can't necessarily tolerate now?
No, I think what we're looking for is to invest less in the present and more in the future.
Okay.
We have to create an economy that can compete with industrialized nations throughout the world. American innovation is often found in times of severe economic crisis, like Microsoft was, like Intel was. And I think that this nation, more so than any in the world, has the ability to innovate and to do things better than anybody else. And I think we have to get back to that by investing in people right here in our country, investing in human capital. You spent $51 billion rebuilding Iraq. You spent $30 billion rebuilding Afghanistan, and yet cities in the Northeast, need infrastructure spending.
The counter-argument would be government should get the heck out of that. Just let the people and the rising tide of economic prosperity from that innovation lift all of our boats and keep government out of it and put more money supply side on and on and on.
I'm very confident about the economy of this nation moving forward. I think that the confidence in the economy will come back. But we've been through some severe economic times, and there are a multitude of reasons for it. Both parties are responsible. But I think America has demonstrated time and again, for every recession, we have a recovery. And I am hopeful and I'm confident that if we make the right investments in human capital and infrastructure, we will have a recovery that's robust and creates jobs which will drive down the deficits that have been accumulated over many, many years.
All right, I'll try to pick up the pace here. Joe, we apologize. I've been yakking too much. Maybe he has. You're on the air now. Go ahead.
Thank you. First of all, I'd like to thank Congressman Higgins for his leadership promoting the public option and universal health care for all people. I'm a retired factory worker, and it affects me personally. Years ago, when everyone was touting that choice was the way to go for health care, I had a choice of various different health insurance companies, like Independent Health and some of the other ones, which did provide preventive care. now, because the companies have been cutting back severely on our options, I have no option now. Okay, so I could really use a public option that would provide preventative care for me, and some of the things, and pay for doctor visits and things like that.
Joe, tell me, as long as you're on the line, I hear that you want a public option, but how do you want it to look? What do you want to make sure is in it? Or on the other side of that, what do you want to make sure it doesn't do?
Well, I want it
what
to
are
be
you willing
a
to
check
pay for
against
this?
the for-profits, first of all, to bring the costs down for everyone. It should the public option will keep these for-profits in check and actually bring the prices down. Okay, that's what I want to see, and I also want to see preventative care. And from what I read about the public option plan that they're talking about, it does have a preventative care provision in it. If perhaps Congressman Higgins might want to expound on that.
Okay, we're going to let you go and let him do that. Go ahead.
Yeah, preventive care, call it what you will, is designed to encourage healthier lifestyles and to lessen the disease burden, which consumes a lot of your healthcare dollar. But as Joe said, this is an option. This is an option. These are very conservative principles to provide choice and competition for people. Folks don't have that kind of choice, and we don't have that kind of competition right now. The system is evolving. Those who do it well, deliver high-quality health care at the lowest possible cost, they will survive. They will survive and flourish within the context of healthcare reform. Those who are overutilizing, those who are wasting healthcare dollars, those who are not producing the clinical outcomes that people in this nation have come to expect, those are the ones that will be weeded out. So what we're trying to do through choice and competition is create a lean and muscular healthcare delivery system, which we don't currently have.
All right, Jordan Kaisertown, come ahead. You're on the air.
Oh, yeah, good morning, gentlemen. Yeah, I was born in 1956, and the medical bill was $56. And back in 56, we did not have an FDA, we didn't have Medicaid and Medicare. The free market handled health care, and it was affordable to everyone. So why don't we just eliminate the FDA, eliminate Medicare and Medicaid, abolish it, and let the free market handle health care? I'll hang up and listen.
All right.
Well, in the mid-'60s, when Medicare was, the idea was advanced, it was criticized. But at that time, 50% of senior citizens didn't have any health care coverage. Nothing. Today, they're all covered. It's a program that works. It's efficient. Most Medicare recipients are happy with their care. I think it's a successful program. But keep in mind, it's not the only option. People can go to private insurance if they choose to. And I think, it's very American to have the opportunities of competition and choice and everything that is inherent in those opportunities.
Would any of the new options that are on the table reduce the cost of Medicare and Medicaid, or the cost burden that the government is footing?
Well, what we're trying to do is move from a fee-for-service system, which drives utilization, and some have argued, based on fact, that it leads to overutilization. You're doing too many procedures that it's costing a lot of money because there's a profit motive to do it. That's fee-for-service. What do you move to? What's referred to as bundling. I know that's a bureaucratic word. What it basically says is, as opposed to treating Dave Debo on a fee-for-service basis, doing a lot of procedures, a lot of tests, we're going to give you an amount of money to manage his whole health care.
Initially, this is what HMOs started to be way back when.
Exactly.
It's the old HMO model.
And I think the independent health, I think the Health Nows, I think the Univeras, I think they do it well. But I think we have to move to a broader system that looks at patient quality overall. And if you're kept healthy, there's going to be less of a cost associated with providing you with health care.
All right. The chair recognizes Henry in West Seneca. You have the floor. Go ahead.
Yes, we've heard the party line. We've heard the setup calls. I have just 2 or 3 questions. First of all, if it turns out that the bill that comes before Congress is not the one that lets us all go to the Cleveland Clinic, but is the monstrosity that's been talked about, how will you vote at that time? Number 2, with the horror stories that we've heard for the last 60 years about the government health care, including the VA system, How do you propose to control that when you haven't been able to control it for the last 50 to 60 years?
All right, let's get the answers, and we're glad you called. How would you vote on the big, publicly operated kind of monstrosity? Now, we've been talking about Cleveland Clinic model, but on the kind that Henry in West Seneca here has. How would you vote?
Well, there's not a final bill before Congress. There's a lot of play here. There's a lot of game left. There's a lot of rigorous debate that's going to occur before there is a final plan. It's made its way out of 3 House committees. It's now in the Senate, and we will have a bill before us. I'll tell you what I'm looking for. I'm looking for explicit language that moves us from fee-for-service to bundling, to complete care. I'm looking for explicit language that talks about comparative effectiveness research in terms of what is the best treatment for these set of symptoms. I'm looking for accountable care organizations that provide a financial incentive to hospitals, to groups of doctors, to keep you healthy. I mean, that, in the end, is the philosophy of the Mayo Clinic. That is the philosophy of the Cleveland Clinic. It's the philosophy of Johns Hopkins. And they are consistently rated the highest quality, low-cost providers of health care in the entire nation and the world. I want that for the people of this community.
And if that's not what ends up, do you see yourself voting for a government-run plan?
I see myself voting for a not-for-profit plan that moves us in the direction that we want to move in. Healthcare reform doesn't need a finish. It needs a start.
Okay.
It's been talked about for 60 years. It's breaking American businesses. It's breaking individuals financially. We have the highest infant mortality rate in the industrialized world. Unacceptable. Unacceptable for a nation that pays more than anybody else and 2 times as much as most people. We're 37th out of 191 countries in terms of health performance. Unacceptable. We have the technology, we have the know-how, we have the human infrastructure, we have quality doctors, we have quality nurses. Buffalo and Western New York gave the nation and the world cancer research. We got to address that within the context of healthcare reform as well.
All right, on the other side of the break, we're going to try and go rapid fire, write down, question and answer, about 5 minutes left. This is Hardline on News Radio 930 WBEN.